Project Alzheimer's Disease by Marija Drozdek. As the global population begins to age, Alzheimer's disease has become increasingly prevalent. According to the Alzheimer's Association, an estimated 5.3 million Americans have been diagnosed with Alzheimer's disease, and around 50 million people have Alzheimer's worldwide. The increasingly high prevalence of this disease will be discussed in this presentation and its implications on society. In this presentation, we will look at the history of medicine's understanding of Alzheimer's, changing definitions of the disease, varying forms of treatments, and society's view of the disease. The history of Alzheimer's disease. Alzheimer's disease was first conceptualized in 1906 by Alois Alzheimer, a German physician. At a German asylum, he treated a woman who was 50 years old and reported rapid memory loss, aggression, sleep disturbance, and confusion. He initially diagnosed this woman with arteriosclerotic brain atrophy and treated her by prescribing a warm bath to soothe her condition. Her mental state worsened, and she died within 5 years. Upon looking at her autopsy, Dr. Alzheimer saw that the woman's cerebral cortex was atrophied, meaning that it was wasted away. He also noted that the sulci, which are the grooves in the brain, were widened. Dr. Alzheimer was shocked and perplexed by his observations of the woman's mind, primarily due to her young age, and she developed such advanced stages of dementia. He and the medical community at the time were fascinated because there were no exact causes of the disease, and it was such a new concept. Although the medical community understood several mental disorders, this particular case led to Alzheimer's as a distinct neurological illness. Since the disease's conceptualization, Emil Kraepelin, who was a student of Dr. Alzheimer, continued his work and named the disease after him. Alzheimer's disease was then split into two categories: Alzheimer's, which is reserved for those under 65, and senile dementia, which is used for those over 65 years of age. However, significant scientific advancement showed that age was not a specific indicator, so Alzheimer's is now used as a group entity. Also, through the advancement of technology, plaques and neurofibrillary tangles have become markers of Alzheimer's in the brain. The medical community has still not found exactly what causes Alzheimer's disease. However, scientists believe that a combination of genetics, environment, age, and lifestyle factors may cause Alzheimer's. Even though Dr. Alzheimer initially diagnosed his first Alzheimer's patient with arteriosclerotic brain atrophy, the disease's symptoms and definition have not remarkably changed. Just like back then, Alzheimer's patients today are believed to suffer from rapid memory loss, aggression, sleeplessness, confusion, and personality change. However, today there are more specific symptoms related to the disease, such as poor judgment, reasoning, preserved skills, and difficulty performing daily tasks. An important thing to note about Alzheimer's disease, which points out to how far the medical community has evolved in its understanding of Alzheimer's, is the difference between Alzheimer's and dementia. Before Dr. Alzheimer first conceptualized the disease, he and the medical community at the time understood the concept of dementia, which is an umbrella term to describe the deterioration of the brain and general symptoms such as memory loss or inability to perform simple tasks. However, Alzheimer's is a distinct disease that impacts the brain. The medical community has treated Alzheimer's disease in various ways. Historically, there was an understanding that the brain degenerates as one gets older, which led to minimal exploration of the topic because it was seen as a standard feature of life. The understanding of age-related cognitive deterioration can even be traced back to writings produced by Galen, Hippocrates, and Plato, just to name a few. Since then, there has always been a stigma surrounding those with mental disorders, which has made life harder for those diagnosed with forms of dementia. Mental diseases were traditionally treated in asylums to avoid irritating and stimulating the patient or disrupting society. For instance, Dr. Alzheimer prescribed his patient warm baths in isolation. Other forms of treatment of Alzheimer's include diets, weak electrical currents, and hypnosis. The modern-day treatments have changed drastically from those used by Dr. Alzheimer and the early medical community. Now patients are traditionally treated with acetylcholinesterase inhibitors known as donepezil, galantamine, and rivastigmine. While there is no cure for Alzheimer's, there are various medications and therapies to manage the symptoms. Since the 1970s, the medical community has committed to finding the causes and cure for the disease. Also, advancements in medical technology have made it easier to detect Alzheimer's in its earliest forms, helping slow the progression of this relentless illness. Mental conditions have been poorly understood throughout history, leading to poor treatment of individuals suffering from mental disorders. An exceptionally dark time in society's treatment of those with dementia was during the height of the witch hunt in the 14th and 15th centuries. Many of those with dementia and other mental disorders were victim to being labeled as witches and were burned at the stake. Situations like these result from society's false understandings of mental disorders. These misunderstandings that led to stigmas attached to those with mental illnesses. Even today, despite growing mental health awareness and education, people who are diagnosed with dementia live in isolation out of fear of society. Although society is growing to understand and support those with mental illnesses, there's still much work to be done.